Hi, I'm Dr. Preethi. In this video, let's explore and find out more about laparoscopic surgery, or rather minimal access surgery. A lot of you all would have heard about laparoscopy, or rather keyhole surgery or minimal access. All of this means the same. Let me tell you in detail about what exactly this is and what are the benefits and what are the downfalls. So, in the last decade or two, laparoscopy has literally taken over open surgery. இப்போ open surgery na enna? Whereas when we have any gastro issues or any abdominal issues, we have to undergo a surgery which involves opening up the entire abdomen. This kind of open surgeries have a lot of downfalls where the healing time is pretty long. The recovery takes weeks together. And by the time you recover and get back to work, it's again easily a month or even more than that. This is where laparoscopy came into place. Laparoscopy is nothing but where we do surgeries via very small openings which we make through the abdomen. So literally a centimeter or two sized openings are made through which a camera is first introduced. So this is a very beautiful HD camera. So the entire abdomen in whatever particular region that we want to look into is very clearly displayed. The next would be introducing smaller ports, which is hardly 5 mm. So 5 mm ports through which various instruments are introduced to address that particular issue. So let me give you a little bit background information about laparoscopy. Laparoscopy was initially brought into the picture somewhere in the 20th century. Initially, there were only simple procedures performed via laparoscopy, like lap appendicectomy and lap cholecystectomy, etc. But now, laparoscopy, or rather keyhole surgery, has taken over or dominating, I would say, than open surgeries. In the current era, almost all open surgeries can be done via laparoscopy as well. So let's talk preparation for laparoscopic procedures. Say you're planned for a laparoscopic surgery. What are the things that you need to expect? So your doctor or your surgeon will run you through certain pre-op evaluation tests. So this will basically include basic routine blood tests. Apart from that, of course, they'll put you through a ECG and a chest X-ray and an echo if necessary, depending on your age and your comorbidity. After the preliminary tests are completed, you will have to visit an anesthetist to take your fitness for surgery. Additionally, specific instructions regarding your fasting period. Generally, preferably, we would require a 6 to 8 hours of fasting for any surgery preoperatively. So let's dive deep into how laparoscopy is performed. The procedure basically begins with very small incisions. Initially, it's usually around 10 mm incision that's made through your umbilicus or any other region in your abdomen which the surgeon actually feels is required. So via that port, we insert a camera. So this camera gives us a complete picture of the entire abdomen. So this is like a visual guide which allows the surgeon to perform various surgeries. So following this, there are multiple other ports that are made depending on what procedure is going to be performed, and appropriate instruments are introduced into the abdomen. Thereby, the surgeon is able to work inside the abdomen while looking onto the screen from which the camera displays the picture. So the scope of laparoscopic surgery. So when it comes to general or gastro surgeries, there are a lot of surgeries that are done laparoscopically, like laparoscopic appendicectomy, laparoscopic cholecystectomy, that is your gallbladder removal, lap fundoplication, lap rectopexies, lap ovarian cystectomies, lap gastrectomies. It's also used for lap gynec procedures and urological procedures.